Okay, so thanks everyone. So today we've got Tessa and Myah, who are our OT students on placement with us, and they're going to be doing the talk on manual handling. As we know that a number of people with FND have been sent home without much carer education and without much education on manual handling techniques. So they'll be taking over. I'm going to make Tessa the host and she can begin. You've got it, Tessa.
Cool. So as Kate mentioned, we will be talking about manual handling, focusing on carers. So manual handling tasks are something that we do perform every day. So manual handling is defined as any activity that requires a person to exert force to push, pull, lift, carry, lower or restrain any person, animal or object. So just based on that definition, could you pop in the chat just some ideas of the tasks that you might do every day that require manual handling? Cool. So some of the tasks that some of you did come up with are here. So vacuuming, mopping, sweeping, shopping, etc. So manual handling of people, particularly assisting clients with daily activities, including domestic tasks, personal care and mobility, constitute a large proportion of the manual handling activities performed by carers. And so the manual handling tasks which result in the highest risk of injury are moving and supporting people for personal hygiene reasons, assisting people in wheelchairs, and handling wheelchairs in and out of cars. So performing these tasks with unsafe manual handling techniques increase the risk of injury, and when injured, carers are less able to fulfill their role or will continue to perform that role with injury and pain. So approximately 30% of injuries in the disability sector are related to manual handling. There are significant associations between back pain and frequency of manually moving patients. For example, transferring them between a bed and a chair, performing bed mobility tasks, and manually lifting clients from the floor without equipment. The most common injury is to the lower back, with most manual handling injuries resulting in sprains and strains of joints and adjacent muscles. Carers are at most risk of strains to the back, neck and shoulders when bending, lifting, pushing, pulling and exerting high or unexpected forces. While there are obvious physical risks to the carer when performing manual handling tasks, it is also important to note that there are risks to the client which are both physical and psychological due to the loss of independence and autonomy. For this reason, it is important for the carer to encourage the person to assist as much as they can in order to maintain independence where possible. So I'm going to show you a few different pictures now, and I just want you to give me a thumbs up if you think it's safe manual handling and thumbs down if you think it's unsafe manual handling. So here's our first one.
Thumb up or thumb down? What do people think?
Or you could use the reactions as we've got there. So this is an unsafe manual handling technique. So when lifting, we want to make sure that we're maintaining the natural curve in the spine. So bending at the hips and knees only. So this will mean you'll need to have a wider base of support. So your feet will need to be about shoulder width apart when you're lifting. And here's our next one. So thumbs up or thumbs down. Yes, that's right. This is unsafe. So when moving, we want to avoid twisting because this will put additional strain on the lower back. So instead, we should take steps to pivot and change direction instead of twisting at the back. And here's our next one. So thumbs up or thumbs down. Yep, that's right. This one is a safe manual handling technique. So the person is holding the load nice and close to their body at about waist height. So this does reduce the amount of pressure that's on the lower back. And this one, thumbs up or thumbs down. Perfect. This one is pretty obviously an unsafe manual handling technique. So in this example, the person could really use the help of a ladder or in general, just some equipment to safely access and lift the load. So this does actually apply in all circumstances, that if there is equipment available that could make the manual handling task safer or reduce the demands, it should be used. And last one, thumbs up or thumbs down. This is a bit of a harder one. So this one is kind of a good example of manual handling. So it shows that the person is assisting the person in the wheelchair, helping them to do as much as they can on their own and not taking on their full weight. So this slide just shows a summary of safe manual handling techniques. Of importance in this slide, we're going to point out step one, which is thinking through the task and assessing the load. So before you perform any manual handling task, you should first think through the task, which includes determining if you need someone else to help you or any equipment, or if you're able to do it independently. The other aspect that you should think through before lifting is where you're moving the object to, how you're going to get it there, and if your pathway is free of hazards. So during a manual handling task, the spine is under the most strain. The risk of injury increases when the body is in postures that deviate from neutral. The risk and severity of injury increases when weight is then added to the body in these postures. These injuries can include chronic neck and back pain, pinched nerves, degeneration of spinal disc, and muscle imbalances. So for example, if you were going to bend your back without bending your knees, the vertebrae of your back will then push together and compress the disc. So this is why we want to make sure we're bending our knees and hips when we're bending down. Maintaining the natural curves of the spine also allow the muscles to work with minimal effort, as they're in the spine and the rest of the body are in the most powerful position and most efficient.
A risk assessment determines the factors involved in client manual handling tasks. Through analysing the task, you are able to identify the source, nature, and degree of risk associated with performing the task. This assists in determining the likelihood and severity of injury based on the risk involved. The hierarchy of risk controls shows that the first thing you want to do is eliminate the risk. This means that the risk is removed completely. Substituting the risk changes it so that a safe practice is used for both the worker and the client. We will mainly be focusing on ways of eliminating and substituting risk today. We have a video to show you of some unsafe manual handling.
Hello, and welcome to this Healthcare Safety Services video about unsafe people moving and handling techniques. Based on research and case law, these techniques are regarded as unsafe and condemned by professional bodies. Therefore, these techniques should not be undertaken and are totally unacceptable. Each of these techniques will now be described and demonstrated, and in the orthodox lift, one carer stands on each side of the service user, putting one arm around the service user's back and one arm under the leg. As you can see, the carers are bent forward. The service user's weight is on their arms, and the service user's centre of gravity is well away from theirs. All unsafe positioning. They now attempt to lift. The service user's weight is all to one side. The head remains low. The feet come up and the service user jackknifes but doesn't move. On the second attempt, they are able to move the service user a short distance by dragging the sheet. Variation of the orthodox, also called cradle or fireman's lift, include a drag lift into a sitting position and then taking a leg each, or a drag lift into sitting position and allowing the service user to put their arms around each of the carers' necks. The carers could sustain serious neck injuries. Next, we look at the bear hug or the pivotal lift. Firstly, the service user's feet and knees are blocked from in front, preventing the service user from standing, even if they're normally capable of doing so. The carer's arms go around the service user's back. The service user puts their arms around the carer's neck, which can cause a serious neck injury, as the service user goes from chair to bed, swinging all their body weight from the carer's neck. Both parties are now displaying poor posture. The service user cannot lean forward to sit down. The carer cannot lean forward to release the service user, therefore they both fall onto the bed.
So those were videos of things that you shouldn't do with people, some manual handling tasks that are unsafe, and we're going to go through some ways to do it safely now. So to eliminate the risk of manual handling injury when lifting people, there is a no lift policy. This policy states that people should not be lifted by another person unless in a life-threatening situation. Carers should not be providing assistance to clients where they are lifting most or all of the client's body weight. If a carer should need to do this, then the risk should be substituted using equipment. Slide sheets eliminate the need for lifting when moving clients horizontally, primarily on bed sheets. Slide sheets are made from a low friction material and when placed underneath the client, allow for easy gliding to reposition the person in bed. Slide sheets are relatively low cost and have a lifespan of approximately 80 washes. As part of the risk assessment prior to performing the task, the slide sheets should be inspected for tears or other damage. While slide sheets are relatively simple to use, carers should still be trained in their use, as incorrect use can cause injury to both carers and clients. The main injury that can be caused to clients is hitting their head on the bed head or wall when sliding the person up the bed. If moving too quickly, this can very easily occur. Slide sheets can also assist in moving the client along the floor, if in a confined space, into a more open space where a hoist can then be used. While slide sheets do eliminate the need to lift and overall reduce the manual handling demands, the person should be encouraged to perform bed mobility or stand from the floor independently if possible. This is important for maintaining the person's autonomy, independence, and dignity. And we also have another video to show you of how to use a slide sheet. Hoists are another piece of manual handling equipment that assists in standing from a chair, transferring from a bed to a commode, transferring to the toilet, transferring into wheelchairs, and assisting in standing from the floor. Carers should first be trained in fitting slings and the proper use of a hoist before use. As each particular brand and type of hoist have different functions, carers should be trained on the hoist that they will be using so that they are familiar in its function and use. There are three main types of hoists, as you can see here on the slide. A mobile hoist is used for lifting a client inside a sling and has wheels so that it can be moved along the floor. A standing hoist assists people between sitting and standing positions, and a stealing hoist is similar to a mobile hoist in that it moves the client within a sling. However, it moves along a permanently mounted ceiling track. Today, we will focus mainly on mobile hoists. Mobile hoists are used to transfer people who are not mobile between locations. The reason we choose to focus on mobile hoists today is because they are the most cost-effective, as the same hoist can be used for a variety of tasks and it can be moved to different locations as required. Normally, 2 carers are required when hoisting a client. Some of the other factors that need to be considered when using a mobile hoist is that it requires routine checking and servicing. They also have weight limits, so as part of the risk assessment, the client's weight should be checked to ensure that it is less than the weight limit of the hoist. Hoists are powered by batteries that require regular charging. As such, this is something that should also form part of the risk assessment to ensure the batteries are charged. There are a variety of different bases available for mobile hoists, with some that can expand or contract to fit around or under commodes, shower chairs, recliners, wheelchairs, and beds. Not all mobile hoists are safe for use when lifting a client from the floor, so if this is something that is a concern for you, you will need to ensure that the feet or base of the mobile hoist you are selecting will allow for this. As you can probably imagine, hoists are relatively large pieces of equipment, so you need to ensure that you have enough space in the room to use a hoist, as commonly furniture can restrict movement of the hoist. Adequate storage space is also required, close to the location where the hoist is used. And here is a video showing how a mobile hoist can be used to transfer a person from a chair to a wheelchair.
Choice of sling loops and communication. Before you begin any lift, always carry out a risk assessment for both your safety and that of your residents. Check that the environment is clear of hazards and is uncluttered. Check that the equipment you're using is in good condition. Check that the resident is safe to lift and explain to them what you're going to do. This is all part of your dynamic, day-to-day risk assessment.
Before applying, check that straps and labelling are visible on the outside of the sling. Then, ask the resident to lean forward or assist them in doing so. Carefully feed the sling to the base of their spine, ensuring that it is positioned centrally. One at a time, ease each leg strap down the side of the resident's legs. Do this carefully to avoid dragging on their skin. Bring each leg strap under the resident's thigh. Placing their foot on your leg will allow you to do this with greater ease. Ensure that the straps are smooth and the fabric does not gather. Notice how Aspire slings have a yellow central loop. This can be used for additional dignity and comfort during the lift. When carrying out the transfer, one carer should look after the resident and the other should operate the lifter. Lower the spreader bar to chest level. Extra care should be taken to ensure that it doesn't come into contact with the resident, causing harm. Next, attach the sling to the lifter, ensuring the loop sits securely on the spreader bar. Sling attachments may vary. Always ensure you understand and follow correct procedure. And the loops you choose will differ from resident to resident and depending on the transfer being carried out. In this instance, we are moving from a chair to another seated position. Therefore, we are choosing short loops at the shoulders and longer loops at the legs. It is important that both caregivers communicate with each other at all times, especially when attaching the sling to the lifter. Shoulder straps must match each other and leg straps must match each other to ensure that the resident remains safely in the sling. The lifter's brakes should be off to accommodate for the sudden shift in the lifter's centre of gravity. Tell the resident what you're going to do and begin the lift, ensuring their arms are inside the sling. When the sling becomes taut and just before the resident's body leaves the chair, check that all sling straps are still securely sitting in the spreader bar. If they are not, bring the resident back onto the chair, adjust, then continue your lift. Lift the resident just high enough so that their bottom will not drag on equipment during the transfer. When moving the lifter, don't forget your safe manual handling practices. This is an example of an unsafe way of moving the lifter, putting your shoulder at risk. The shoulder joint is one of the most commonly injured body parts when moving and handling residents. Protect yours by keeping your elbows by your side and below shoulder height. Remember, while one caregiver is controlling the lifter, the other should be protecting the resident and ensuring they do not come into contact with the lifter, causing accidental harm. Notice how the caregiver brought the wheelchair to the lifter. This reduces the manual handling effort and should be done whenever it is safe to do so. When the resident is at the desired destination, guide them as the lifter is lowered. When they are sitting safely, ensure that there is enough slack in the sling straps and carefully detach the sling from the lifter, making sure that the spreader bar doesn't come into contact with the resident. Take the lifter out of the way and remove the sling. The sling's material is gently being folded back, not pulled or dragged. This care will help to avoid skin tears that cause harm to your resident. Remember these steps and our 3 focus points: correct caregiver positioning, choice of sling loops, and communication.
So people that provide assistance to wheelchair users are frequently family members. So if they are not trained, they are generally at higher risk of physical harm. So because wheelchairs can be difficult to manage. Lack of training in how to use a wheelchair can result in decreased community access, as the caregiver and the wheelchair user do not know how to overcome obstacles such as curbs safely. It is important that carers communicate with wheelchair users when they are assisting them in propelling their wheelchair. This preserves the person's autonomy in knowing what is happening and when. It also improves safety of both the carer and the wheelchair user, as they are not startled when they begin ascending or descending a curb. So when ascending or descending a curb, communication between the carer and the wheelchair user is key. So to ascend a curb, the carer should align the foot plate, so this part here of the wheelchair, with the edge of the curb. Next, the carer should use the tilt bar that's at the back of the wheelchair to tilt the wheelchair back so that these small wheels or the casters are over the curb. The carer should ensure that this is not performed suddenly, instead preparing the wheelchair user by moving on a count of 3. The carer then needs to brace in the line of direction that they are going and use their hip to lift the wheelchair on top of the curb, again moving on a count of 3. By using your hip, this reduces any strain or pressure going directly through your back. To descend the curb, it is a reverse, so moving the wheelchair backwards. It is important that the carer does not place their leg on the curb when descending, as this increases their risk of injury. Instead, on the count of 3, to prepare the client to go backwards, the carer should brace their core and bring the wheelchair onto their hip again. This will provide for a more smooth and controlled downwards movement. While keeping a firm hold on the wheelchair and maintaining the person's balance in the wheelchair, the carer should then slowly lower the small wheels from the curb. So this slide just shows the parts of a wheelchair. So these are the small caster wheels that we were talking about, and the footrest are here. So before lifting a wheelchair, you should first make sure that the brakes are on so that it doesn't roll away. Next, you want to make sure the wheelchair is as light as possible. So this includes removing anything from the wheelchair that can be removed. So this is your armrest, cushion, and footrest. To fold the wheelchair, you need to brace yourself for the lift. So this involves standing to the side of the chair in the feet positions shown, with one foot in the direction of the lift and the other foot facing the chair. So this gives you your wide base of support that you need to safely lift the wheelchair. Your knee should also be bent and engaging your core. These two dots will show where your fingers should go to smoothly lift the wheelchair and fold in one smooth movement. To then lift the wheelchair, you need to place your hands on either side of the frame, bracing as you did when folding. Bend your knees and engage the core to lift the wheelchair onto your hip. So this video here will show this process, including one method of how to place a wheelchair into the boot of a car.
This short film shows how to put a wheelchair into a car boot. Make the wheelchair as light as you can by removing the foot plates. The latch is usually just under or to the side of the foot plate. Also remove the cushion. The armrest can also be removed to give extra space if you have a small car. The latch is usually at the front of the armrest. Fold the chair by pulling the middle of the seat upwards. Tilt the wheelchair towards you so gravity helps you. Lower the backrest into the folded position by releasing the latch on each armrest. Release the wheelchair brakes and wheel the chair to the car boot. This avoids having to lift the chair. Put the brakes on. Bend your knees, keeping your back straight but not rigid. Take a firm hold of the wheelchair rims. Tilt the wheelchair towards you slightly and lift in one smooth movement. It can help to place an old towel or rug in the back of the car to protect the boot sill from damage as you lift the chair. This is also useful to dry the seat and wheels if the wheelchair gets wet. Place the cushion between the wheelchair and the boot door, as this will help to stop the wheelchair moving about in the boot when driving. You could also use one of the rear seat belts threaded through the wheelchair to help anchor it while driving.
So there are many different ways to get a wheelchair into a car, and that video showed one option, but this method did require a high amount of manual handling and the risk of injury involved due to the lifting, carrying and lowering of the movement into the boot of the car is quite high. So to eliminate this risk, you can use equipment. So the first image here shows a wheelchair cradle, which can be attached to the tow bar of a car. So this one in particular has a tilt mechanism, which means that the cradle can be tilted down to load the wheelchair, eliminating the need to lift. Pulling the wheelchair from the front, the weight of the wheelchair will assist in balancing the cradle. Using this method, straps should also be used to secure the wheelchair in place. Benefits of this method is that it frees up boot space, as the wheelchair can be kept external to the car. However, you need to be more cautious of securing the wheelchair in place. The mechanism is also relatively easily removed. This piece of equipment reduces the manual handling demands as the wheelchair is pulled rather than lifted, with the mechanism assisting in tilting the weight.
Equipment options also includes portable ramps, which can be stored in the boot of the car and hook onto the back of the car for use. This reduces the risk of injury from manual handling as it changes the lifting, carrying and lowering movements into a pushing movement. Pushing, however, can also cause injury, so using a portable ramp does not completely eliminate the risk, but substitutes it. The other challenge of using ramps is that you need to ensure that there is enough room to attach the ramp for use when parked to load and unload the wheelchair. You also need to ensure that there is enough room to fit the ramp into the car with the wheelchair in place. A hoist can also be used to transfer a wheelchair into a car, eliminating the risk of injury due to manual handling. There are different hoists based on the weight of the wheelchair, with two-way hoists and four-way hoists, depending on the weight of the wheelchair. To use a hoist, you would still need to fold the wheelchair as normal. However, the lifting demands are eliminated as the chair is attached to the hoist via a hook, which uses power to lift the wheelchair into the car. Generally, you'll still need to assist and guide the wheelchair into the car. However, through this method, all lifting is eliminated. So we're going to show you a few videos of using these devices now.
So this first one is the cradle. And this one is showing a car hoist.
This is the 40 kilogram hoist to show you how to use the 40 kg hoist. It's got a folding arm. Lift it up like that. Quite a small car this, so it's a bit of a tight fit. Put that up through there, through the frame. It'll lasso the chair like that. And then using the handset, wind it up all the way to the top here, and then sort of swing it in, post it into the boot. It's got a neat fit. Bit of slack there. Handset's magnetic. Just drop that one there like that, switch it off at the top. You've got a lifting, a folding mechanism here, which is
So now we're going to do a Kahoot. So I'll pass over to Maya, but while I'm doing that, if you can find a phone, an iPad or anything that you can search Kahoot, I think it's .it, or just Google Kahoot, and we'll load the game pin for you to join.
Okay, I'm about to load the game pin. So you just need another device, like a phone or an iPad or a tablet. So you type in this address into Google and then there's the game pin. If you're confused, just type in the chat and we can help you. Well, we got one person in. 2, 3. That's good. So I'll just mute it for a second. So has anyone ever played Kahoot before? No. All right, so what's going to happen is there's going to be a question that pops up on the screen, and then it will change to the question and answers on the screen. And there's 4 different colors for the 4 different answers. And on your phone or whatever you're holding, the colors come up, and you just have to hit the color of the answer on that you think it is on the screen. Does that make sense, or does anyone need another explanation? Thumbs up if we're all good to go. Excellent. I think, is everyone on? 1, 2, 3, 4, 5, 6, 7, 8. I'll leave it another minute. And there's 1 minute to answer each question, so don't feel like you have to rush really quick to pick an answer. I'll turn the music back on. Let's get started. Manual handling quiz. Okay, so what is manual handling? So hit the color on your phone to which answer you think it is on your screen.
And if you're still joining, the game pin's down the bottom still.
Yeah, down the bottom. That's it. We still got 25 seconds. Just hit the color you think. Excellent. Everyone got that correct. So manual handling is like requires you to exert force to push, pull, lift, carry, lower, or restrain. Excellent. Well, HINS is on the leaderboard. So you get points for how fast you answer and if it's a correct answer also. All right, next question. Which are good manual handling techniques? So click the picture or the color on your phone, which corresponds to the good technique.
I can only see the blue corner. What's happening? I don't understand.
You can see the blue one, is it?
Yeah, I can see the blue and the red now. I can't see anything else.
Oh no. I'm not sure what's happening. Are you using a separate device, Robin?
Yeah, I'm looking at my laptop, and when I look at the other on my phone, it doesn't go down and give me anything other than the 4 squares.
Yeah, so you have to pick the red, blue, yellow, or green on your phone.
Yes, but I could only see the blue one over here. Now I can see them all.
Okay, yeah, you might need to scroll down.
Yeah. Oh, I lost.
That's okay. This is just a fun little quiz anyway. Yeah, so this is correct. Everyone got it correct because she's got her spine in a neutral position and she's carrying it very close to her body. Okay, next question. Hopefully it works for you, Robin, this time.
Thank you. Yeah.
Well, HINS still in the lead. Which is not a safe manual handling technique? I think there's still one more person to answer. If you don't know, just take a guess. Maybe try scrolling down, Robin, on your phone. Does that help you get the answers?
Doesn't matter. I'm sure I get it.
Well, you can just think it in your head. Excellent. Everyone got it correct. So bending your back and hips is not a safe manual handling technique. Okay, question 4. Oh, Hins. Streak with 3 correct answers in a row. Well done. All right, question 4. So this one, you have to select more than one answer. What are some injuries from bad manual handling? So once you've picked your answers, you have to hit submit. Ten more seconds. Let's see if everyone got this right. They're all correct answers. So you can get all of these from a bad manual handling technique. So that's good. Everyone got a right answer on that one. Well done. Ooh, Kate's in the lead. And Hoagie has the highest answer streak of 4. Well done. Another multi-select question. What is something to check before using a hoist?
Colour of the paint.
Ooh, that's everyone done pretty well there. I thought I'd get a few people with the swing use. So of course we don't want people trying to swing in the hoist just for safety reasons, but we do want to check the client's weight, as hoists have a weight limit and the battery charge because they are battery operated. And the color of the paint doesn't matter. You can choose any color you want. Next. Ooh, Ross is in the lead. All right, we're halfway. Question 6 and another multi-select. What are parts of a wheelchair? Excellent. Majority of people got that correct. Well done. The pedals, there's no pedals on a wheelchair. They're called the footrest and plates. Sort of similar to a pedal, but just in front, not to the side. All right, let's see who's in the lead. Ross, well done. The top 5 are switching around. Okay, question 7, double points for this one. What do you do when ascending a curb in a wheelchair? Excellent. We want to communicate with the person. And as you all saw in the GIF, that we don't want to go fast because that can happen. You can fling out of your wheelchair. So communicating is the most important point to do. Kate in the lead. Well done. All right, question 8. When folding a wheelchair, I should... Excellent. We want to use the brakes, stand at the side, brace yourself and bend your knees. Well done. Excellent. Kate's still in the lead. You could change. There's 2 more questions to go. Another multi-select. When putting a wheelchair into the car, I should. Excellent. Majority of people got that correct. And wouldn't it be cool to have cars like that around where people can just go straight in with their wheelchair? Oh, there's some shifting, but Kate's still in the lead. All right, last question. Let's go. Okay, to maintain independence and autonomy of the person, I should. Excellent. I'm glad everyone's got that. You should encourage the person to help you as much as they can. All right, let's see the scoreboard. Who's made it to the podium? Hoagie, well done. Ross, well done. Kate, well done. Excellent work, guys. And next. Excellent. Well done, everyone. You all did really well on that quiz. Did you enjoy it? Does anyone have any questions?
Well done, Kate. We had lots of laughs with that one.
Thank you. That's good to hear.
We were very competitive as individuals in this group.
I got confused by the two devices and started like trying to press the things on the computer while I was actually recording it on my phone.
Yeah.
That was a good one.
Well, that's good. It can be confusing with the two devices, but you get used to it after a little while.
Yeah, I've got 5 devices here on the go. So all right, that was really good, guys. Does anyone have any questions around the manual handling? And there may be some things that wasn't quite covered that you might have a question on as well.
I do.
Yep, go for it.
So often when I'm transferred from my wheelchair to the bed and my legs are not working properly, the kids or hubby just sort of like lift my legs any way they see fit and sort of throw them as quickly as possible onto the bed. And I don't know if there's pressure points like at the lower part of your leg, if it's for everyone, but when they pick up my legs, the pain is really not very kind. So I was just wanting to know, do you lift the person's leg from where? Do you lift them like more at the knee? Do you lift at the ankle? How do you help transfer the legs? I can transfer the top part of my body.
So can you sort of transfer, is it just your legs that you need lifting onto the bed? Are you able to sort of get the bottom from the wheelchair onto the bed?
Yeah, not all the time, no, but I've sort of, when it's my whole body that needs transferring, they're sort of good with that. But when I transfer just my backside onto the bed, then them lifting up my legs always ends up in pain because they're either twisting my lower back as I'm sitting on the side and then they pick up my legs and twist the legs onto the bed. And then even when they're lifting up my legs, it hurts. And I don't know if there's a pressure point on your legs or if it's just me having pain there, I don't know.
Do you want to have a go for it, girls? Tessa, Myah, do you want to have a go?
Maybe you can try just having like one person on each leg and like holding your knee and like your ankle at the same time and just slowly spinning or turning you around, not really fast, but just nice and slow. That might help.
And I'd also be careful around that twisting. So if you're sort of sitting at the side of the bed and you're wanting to lift your legs up and then turn around, you need to be careful that your back is not getting twisted. As Myah said, also going slow and that communication, so you know exactly what's happening at what point in time. And I think you said they sort of do it quickly and sort of throw your legs over. That's probably when you're at the greatest risk of injury. And I guess that communication around lifting up part of your leg, your ankle, your knee, and sort of telling you that we're swinging that over so you can slowly twist your body around as they're moving your leg around so that it's being coordinated. Because otherwise, if you're moving at a different speed to the way that your leg is coming around, you're at risk of injury with that. When you talk about the pain in your leg, where are you getting the pain?
So my lower leg just above the ankle joint area, when they hold, I need a here, okay, here's a sample for you. And when they hold my leg here, it's like I've got pressure points either side at that point, and boy, does that hurt. And I don't know whether that's just me and the so-called fibromyalgia, or if there's actually a sore point there on everyone. I don't know. Does that hurt you? Oh, okay. She's tough, this leg.
It may be, like you mentioned, the fibromyalgia, like having pain points as well. So you may have certain pain points yourself, but I guess also finding out like what you did there, sort of having that practice, looking at where is a good point to hold your leg. So when you're not doing the movement, like if you're just sitting still and not doing the movement, just like that, working out where does it feel comfortable for you to be held, and sort of looking at that before you're doing the movement.
Yeah.
Yeah,
I will tell them.
Say a plan, Sue, is what you need. Like when you're feeling good, a plan should be in place how to put you into bed.
Yeah, I should get little red tattoos or something on either side of my leg saying this is the point.
This
where
point,
you have to pick me up.
red cross here. Yeah.
Thank you for that.
Okay. Any other questions there? And for the people who are not on camera, do you have questions? And also, if you're not on camera, you can always put a question in the chat box as well. So there's no questions there, but with the hoist, if you're on NDIS, the hoists are something that you can get approved through NDIS. So you'd need to have an equipment trial. You need to trial different types of hoist to look at what's going to meet your needs. But that is something that you can get through NDIS if it is something that you're likely to need and to use. And that, and especially for people that do end up with paralysis episodes, or if you end up on the floor having drop attacks, seizures, etc., hoists are something that may be required for people with FND, and we can get them approved through NDIS.
Interesting.
And with hoists, you do need a carer as well. People have asked about hoists. Can you do it yourself? Or the ones that I've really seen is where you need a carer to assist. Okay.
I was surprised just regarding manual handling. My daughter's in hospital at the moment, and I've always transferred her myself. And they just looked at her and went, no, she's not getting out of bed. And she hasn't been out of bed in 2 weeks. So
in hospital, they're not transferring her?
Well, they can't. She's using a pan in the toilet, and they said, we can't give you a shower. They're giving her a bed bath. But I've always just given her a full body hug to get her up. And yeah, obviously learnt a lot today.
Yeah, and that sort of body hug can be the ones where you're at risk of injury as well.
Yeah. But I've always bent my knees and made sure that, and she does as much as she can, but she's able to do less all the time at the moment.
Yeah. Yeah.
And I think after 2 weeks of not standing up at all, she's not going to be real good when I get her back.
No, because there's a lot of if she's just in bed, that sort of deterioration and functional decline that you get. Even just spending some time in bed, you really do get a lot of that muscle wasting. Yeah. Any other questions that people want to cover? Actually, that was good timing. That went quickly. Oh, that's good. All right. Well, thank you, Tessa and Myah. That was very helpful. No questions. All right, I'm going to end it. And this will be available for people who missed it. Okay, I'll see you guys later.
Thank you.
Bye.
Thanks, everyone.
Thank you, everyone. Appreciate it.